Welcome to the CIRS podcast, which is part of our web-based project that focuses on the COVID pandemic here in the Arabian Peninsula and the broader Middle East. The goal of this project is to provide a focused understanding of what is happening in the region and how it's affecting the ongoing global crisis. My name is Mehran Kamrava. I am Director of the Center for International and Regional Studies and Professor of Government at Georgetown University in Qatar. And it is my pleasure today to welcome a good friend and a good old friend and a long collaborator of CIRS, Dr. Ravi Mamtani. Dr. Mamtani is Professor of Healthcare Policy and Research and also the Vice Dean for Student Affairs, Admissions, Population Health, and Lifestyle Medicine at Weill Cornell Medical College here in Qatar. He is a specialist in occupational and general preventive medicine, public health, and integrative medicine. Professor Mamtani has also been involved in a CIRS project that we have had looking at politics and policy of healthcare in the Gulf states. And he not only was the intellectual lead in that project, but he was also the co-editor of a book project that came out of that work entitled Critical Issues in Healthcare Policy and Politics in the Gulf Cooperation Council states. So Ravi, welcome. Thank you very much for taking the time to share with us your expertise and insights. I know you're very busy these days, and so it's a pleasure to have you here.
Thank you so much, Mehran. I appreciate it. It's wonderful. It'll be great talking to you and to your team. Thank you.
Thank you so much. Thank you. So, of course, as you know, we're in the middle of this major infectious disease pandemic, and we're battling this pandemic on multiple grounds. Everything has been disrupted, our behavior, our lifestyles. We are now using very readily terms like social distancing, which we were not using before. We're working remotely. Professors are teaching remotely. Everything has been disrupted as a result of this COVID pandemic. But while this is all going on, we cannot ignore non-communicable diseases. And these non-communicable diseases are, as we all know, largely dependent on the lifestyles that we adopt. Let me first begin by asking you, Ravi, what is your take on the evolving face of the COVID-19 pandemic?
Once again, thank you, Mehran. And I think evolving is an appropriate description of what we are experiencing. We haven't seen anything like this, I would say, in about 100 years. And as you rightly pointed out, we are dealing with a pandemic. It's a colossal outbreak of coronavirus disease, which has caused devastation, death, and also social and economic disruption, as have the previous pandemics. I'm thinking of the pandemic, as we will recall, of 1918 due to flu virus, in which the world lost about 5 million people. So this pandemic is worrisome. And the new virus, which is called the novel coronavirus, is causing the disease called COVID-19. So if I refer to the disease as COVID-19, that's what I'm referring to. And again, it's caused by a new virus to which mankind has no immunity, none whatsoever, and is spreading like crazy all over the world. That being said, a couple of things about this disease. First of all, it's relatively speaking a mild disease. In fact, many people who have it show no symptoms. The other important thing is, of the people who have it, 99% will survive. And the third important thing is, we know it is spreading by what I call as the respiratory droplets. And since we know how they spread, it becomes important for us to understand that so that we can prevent it. And I'm glad to say that we've used that knowledge in order to mitigate and contain the disease. Now, that being said, even though the prevention is simplistic, we should not belittle the value of things such as social distancing, wearing a mask, and so on and so forth. Now, that all being said, what is worrisome is one aspect of it, which is it comes in a severe form among the elderly and those who have comorbid conditions. And Mehran, you referred to non-communicable diseases, and we're thinking of diabetes, heart disease, cancer, and so on and so forth. And that's worrisome, meaning people who have those conditions are at increased risk of developing a severe form of coronavirus disease, and perhaps also at increased risk of death. We are learning from hour to hour. I mean, they've been, as we've all heard, changes in medications, treatments. We are hearing about vaccines. So it is, as you rightly put it, an evolving pandemic, and we just have to wait and see what happens. But that being said, it is vitally important that we as scientists, healthcare professionals, social scientists rely on credible information which is based on science and data and not on misinformation that may be coming out of media. So I hope, at least as an introduction, that gives us the context of what we are dealing with.
That's excellent. Thank you so much. So as you mentioned, as this pandemic evolves, there are many uncertainties that we're faced with. Can you elaborate on some of these uncertainties?
Sure, I'll be glad to, and I'll see if I can keep it as simple as possible. The one thing that we have learned is that this disease is being transmitted in its asymptomatic or pre-symptomatic phase, meaning people who do not have symptoms or have no symptoms at all are capable of transmitting this infection. That we know. But the extent to which this transmission is occurring remains unknown. And that worries us because we don't know how serious we should become about the asymptomatic or pre-symptomatic patients. The other thing is the whole issue of immunity. Now, if this virus were to behave the way measles virus has behaved in the past, it is more than likely that one infection will give us long-term immunity. Unfortunately, we are not dealing with measles. We're not dealing with even a flu virus. But it is the belief of most that we will see some immunity. However, the duration and the level of that immunity remains unknown. So that adds to another uncertainty. The third thing I would say is there is this thing about the data, the evidence, and the question that we are being presented with. I'm often asked, Ravi, when do you think the world will come back? When will we lift the restrictions? When will the businesses be reopened? And I'm sorry, there is not much we can say except to look at the data and, as I said, be guided by the evidence and the information that is presented to it. But most importantly, to interpret in light of this evolving phase of the pandemic. The one thing we do not want to see is misinformation that can misguide decision makers, healthcare professionals, and so on and so forth. So we have to be careful with that.
Thank you. So, Ravi, this disease, the pandemic, has radically altered our lifestyles. We can't go to the gym. Many public parks are closed, particularly here in Qatar and in other GCC states. And these changes in our lifestyle are bound to affect our mobility. We have become much more sedentary than we used to be. And so how is this going to impact diseases like diabetes and obesity? Can you give some concrete examples as to how the consequences of this pandemic are impacting our other aspects of health?
Sure. So let me begin with this illustration. It has been well established based on the scientific studies and literature that we have reviewed, that there is a strong cause and effect relationship between lifestyles and the outcome of chronic diseases, as you earlier mentioned. And I'm thinking of diabetes mellitus, I'm thinking of heart disease, I'm thinking of obesity, which are quite prevalent in this region. That relationship is such that if we were to consume a healthy diet, remain physically active, have decent sleeping pattern, and we not smoke, but also are able to engage in stress relieving activities, then we know, and in fact we know, and it has been proven, that we can prevent and even reverse chronic diseases. There's plenty of data to show that heart disease, and I would have never thought that this could happen, that heart disease can actually be prevented by implementing these simple lifestyle measures. Now, the one thing that I want to say, and I want to elaborate on that, Mehran, in a few minutes, about this diet. The diet is extremely important. We must understand what that diet is because it has connotation to the discussion in the situation we are in at the moment. A healthy diet is a plant-based diet, meaning we must eat vegetables, we must eat fruits, we must also consume whole grains, we must consume lentils, and of course also occasional use of fish and chicken. The other interesting aspect of a healthy diet is that if it is home cooked, it is good diet. And the less processed food we eat, the better it is. So that relationship has been extremely well established, and we know that we can take advantage of that. Now, you mentioned something very important in terms of COVID-19's impact on lifestyles. And if I may, I want to present to you with a couple of examples. Let's look at diet and exercise. We are in lockdown situations around the world. That means and entails availability of fresh vegetables and fruits could be challenging for some people. It's not easy to be able to go to grocery stores and pick up these fresh fruit and vegetables to prepare our meals. It is also happening that people are, as a result, beginning to rely on processed foods, on fast foods, none of which is good. Also, and you refer to this, that with park and gym closures, people are less likely to engage in physical activity and spend more time in sedentary behaviors such as doing internet, watching TV, and also which in turn may impair the quality of sleep, which is very important. All of these factors can impact on the risk of non-communicable diseases, diabetes, obesity, and then so on and so forth. Now, that being said, and this would be funny that I'm saying this, I want to look at the positive side. I want to see how we can change in the way we engage in some of these lifestyle factors. So staying home, for example, can encourage people to cook at home, which can be enjoyable, but it is also believed that can have emotional benefits. And it encourages people also to be creative in the way they remain physically active. Walking in the backyard, what's a big deal? Instead of going around one big circle, you go around 10 circles in your own house. I have done this. I walk up and down the stairs. I do that 5 times. I've done my 20 minutes of my physical activity. The point that I'm making, Mehran, is that this is also an opportunity for us to regularize our lifestyle habits and even regularize our sleeping pattern. So on the one hand, it is possible that it may impact on some of these things negatively, but also here's an opportunity for us, given the situation we are in, to be able to make adjustments and do things that will work to our advantage. If I may, I want to talk a little bit about mental health, Mehran, because to me, I think it's extremely important. And if you would allow me, I just want to continue with the story and maybe give you another example of 2, and then we can come back to other issues. Lockdown and stay-at-home situations can result in loss of social connectedness and networking, which can have a significant impact on mental health. In fact, there have been numerous studies and reports that are coming from around the world, which are showing that people who are in those situations have high level of anxiety, stress, depression. There are reports of domestic violence, and also a couple of reports, I'm sorry to say, that discuss the increasing rate of suicide among people. Now, while some fear and anxiety related to uncertainties and this pandemic is understandable, what is not helping is the information overload, and I refer to that. And to that information load, if you add rumors, misinformation, all of which can make you really helpless and out of control. We can be misguided, and it compromises the scientific truth, and in turn may compromise the truthful understanding of this COVID-19, adding to additional anxiety. I just want to present you with one more example. All that said, as I said, not all is gloom. There is a little optimism in all of this. I think we as human beings can be strong, we can be resilient, and we can bounce back. And I'm saying that based on the experiences that we had with SARS, with Ebola. Even though there were spikes of anxiety and depression, there is data to suggest that people were able to make adjustment, they were able to reclaim their control and gain their confidence back. And so clearly there are risks, but also it gives us an opportunity to be able to make adjustments which can work to our advantage.
That's excellent. Thank you so much. So this leads to a related question, Ravi, and this is the measures that we've been experiencing here in the GCC states. Have these states been effective in dealing with the pandemic, or as effective as possible?
My answer is yes. And I'm saying based on my own reading, my review of literature, but also my experiences in the state of Qatar, Mehran. I think Gulf states have been forthcoming. And certainly, as I said, Qatar has done wonderful things. They have regulations in place. They have all precautionary measures in place, social distancing, staying home, encouraging healthy lifestyle practices, provision of adequate medical care. And all of this, in fact, and I say that when you look at the mortality rates in the region, particularly I'm impressed with the lower mortality rate in the state of Qatar, you can only conclude that things that we are doing in the state of Qatar have been rewarding. I have walked into grocery stores here myself. I'm able to get fresh fruits. I'm able to, walk. I wear a mask. They certainly would not let me inside the grocery stores unless they've checked my temperature. And so all of that, I think, is good. And the fact that the death rates are lower, I think, confirms some of the actions that are in place that seem to be working.
Excellent. So along the same lines, do you have any advice for the public?
Mehran, that's a great question. Even though we say it's the public, but these are the people. These are the people who are, many of them are suffering or going through it, and I think needed to be guided. And in simple language, I would say that adhere to the government public health and safe hygienic practices, extremely important. Washing hands, you don't have to be Einstein to be able to wash your hands. And as I said earlier, let's not belittle the importance of things such as washing hands or coughing into your elbow or into a tissue and throwing the tissue away. The second thing is, if anyone experiences any respiratory symptoms, make a phone call or go see a doctor or a healthcare provider. As I said earlier, engaging in healthy lifestyles is extremely important, imperative, and we have no other choice but do the best we can in terms of maintaining healthy lifestyles. Maintain your routine, keep yourself occupied, develop goals and priorities. There's research to show that if people have goals in their lives, if I wake up in the morning and I say to myself, this is what I have to do, I'm looking forward to something, and that's helpful. And certainly remaining socially connected, extremely important with friends, family, even doing things such as cooking for the needy people. And if one sees this pro-social behavior, in fact, is something that's going to help all of us, not just now, but even in the times ahead.
Thank you. That's excellent. Ravi, when do you think society will get back to normal, to the way things used to be?
Mehran, I knew that question was coming, and can I begin by saying not an easy question to answer, but maybe I can share my thoughts with you.
Please.
As I said earlier, we as Homo sapiens are capable of fighting and adapting to new situations. And we have, if you look at the history of difficulties that this mankind has gone through, and I'm thinking of forced migrations, earthquakes, tsunamis, and I refer to epidemics of SARS, Ebola, and so on and so forth. And we've gone through them and we've come out okay. So to me, there is hope. I feel that overall goal should be to create an environment, whether one is a social scientist or a doctor or a policymaker, we should always attempt to create an environment in which there's compassion, there's reassurance, and stability. To me, all of those things will give people hope. And hope encourages humans to adapt, no matter how difficult the situation has been. And as I said, we've seen that in the past. And I would say, by saying, when will we come back to being normal, if you will, there is no one master plan, Mehran. I'm sorry. But one thing we know, as I said earlier, we can bounce back. It's important that we stay in touch with data and be guided by the science. And a simple way to explain this would be, and we are beginning to see that, I think there are countries and societies beginning to open things up in a gradual, cautious, and on incremental basis. So I think if there's one response, there is no one master plan. Look at the data and do things that would be gradual on an incremental basis, and hopefully we should be back to being normal in the months ahead.
That's good. Thank you, Ravi. That's excellent. And I would hate to end this conversation because I'm so enjoying it and learning so much. But I'm afraid we're at the end. Before we end, though, do you have any final comments you might want to add?
Well, first of all, I'm so thankful to you and to your team to be able to have this conversation with me, and I'm grateful. Hopefully, we'll have more of these conversations.
Hope so.
And I want to leave us with some thoughts here. Extremely important that our policies, our thoughts are driven by science, reliable data, and no misinformation, please. Misinformation can create problems. And if you add rumors to it, it can be really bad. We should not be driven by emotions. We should be driven by objectivity. So that's number one. Number two, we as scientists, healthcare professionals, social scientists, people who are involved in this, I think agree that transmission will reduce and that a vaccine will become available and eventually things will settle down. Now, in general, as we go through this pandemic experience, we will learn and we will continue to learn. It is important that while we're learning, we remain empowered, because that will help us regain a sense of control and autonomy. That's extremely important. I think that we will, based on all of this, as I described earlier, we will begin to pay more attention to our lifestyles. We'll become more conscious. We will know what works, what doesn't work. That, to me, maybe is in a way is a blessing in disguise. And healthy lifestyles, in my opinion, will become vitally important. They were important before, but I think they'll become more important in the months and years ahead. So those would be some of my final remarks, Mehran.
Thank you so very much. This has been absolutely enjoyable and informative. Thank you so much for your insights and expertise. And I do hope you'll agree again to share with us some of your knowledge and insights in the coming weeks and months. Thank you very much, Professor Ravi Mamtani.
Absolutely. Thank you so much, Mehran, and I appreciate this opportunity. Thank you.
Thank you. Have a good day. Thanks.